In this session, we will discuss the different pelvic diameters. So the pelvis is divided into three portions. We have the pelvic inlet. We have the pelvic inlet. The pelvic inlet is located at the pelvic inlet is located at the pelvic brim. This is the pelvic brim. We have also what we call the mid pelvis. Mid pelvis is measured between the two scale spines. And the last one, we have what we call the pelvic outlet. So before we start with the discussion on the different pelvic diameters, let's discuss first the directional terms that will be encountered in this session. So first, we have what we call the anterior portion. So if we say anterior portion, these are parts of the body that are anatomically located in front. So in this case, the anterior portion of the pelvis is located in the pubic bones, this portion, and the posterior portion is located at the back of the body. So in this case, we have the sacrum. So first, we will discuss the anterior posterior diameter of the pelvic inlet. So again, in measuring the anterior posterior diameter, we measure the diameter between the anterior portion of the pelvis going into the posterior portion of the pelvis. So first, before we discuss the different anterior posterior diameter of the pelvis, we will discuss first the landmarks that are used in measuring the anterior posterior diameter of the pelvis. So first, we have the symphysis pubis and the sacral promontory. So these two are the landmarks in measuring the anterior posterior diameter. So we have three anterior posterior diameter of the pelvic inlet. We have the anatomical conjugate, we have the obstetrical conjugate, and lastly is the diagonal conjugate. So the anatomical conjugate is measured using the upper border of the symphysis pubis going into the posterior border of the posterior portion of the body, which is the sacral promontory. So next one is we have also the obstetrical conjugate. The obstetrical conjugate is measured from the inner mid portion of the symphysis pubis going into the sacral promontory, while the diagonal conjugate is measured from the lower border of the symphysis pubis going into the sacral promontory. So as you can observe, we have three colored strings. We have the red one, we have the yellow green, and we have the yellow. So the red string represents the anatomical conjugate rather. It represents the anatomical conjugate. The yellow green represents the obstetrical conjugate, and the yellow one represents the diagonal conjugate. So these three are equally important during labor and delivery. However, if we look into its obstetrical importance or significance, it is thought that the obstetrical conjugate is more significant, while the diagonal conjugate is the only anterior posterior diameter of the pelvic inlet that can be measured using vaginal examination. So next one, we have also what we call aside from the anterior posterior diameter, we also have the transverse diameter of the pelvic inlet. So the transverse diameter of the pelvic inlet is measured from both sides of the pelvis. So we have from this point until this point. So we also have the oblique diameter. So if we say oblique diameter, it is the measurement between the sacroiliac joint going to the iliopectineal eminence, which is located in this area. So the normal diameter of the pelvic inlet, specifically the anterior posterior diameter of the pelvic inlet, differs from what type of anterior posterior diameter. So basically they are not the same. So the measurement of the anatomical conjugate is almost similar with the diagonal conjugate here, the diagonal conjugate. So the obstetrical conjugate is much smaller or shorter compared the two. So the anatomical conjugate is measured around 11 to 11.5 centimeters and above, while the diagonal conjugate measures around 11 centimeters and above, although some books may say it's 12.5 centimeters. Now, the obstetrical conjugate, on the other hand, is measured around 10 centimeters and above, while the transverse diameter is measured around 13 centimeters and the oblique diameter is 12.5 centimeters. This session will discuss the remaining portions of the pelvis in relation to labor and delivery. So previously we discussed the pelvic inlet, and for today we will discuss the remaining portion, which is the mid pelvis and the pelvic outlet. So the mid pelvis, as the name implies, located at the middle portion of the pelvis, that is located between the pelvic inlet and of course the pelvic outlet. So the mid pelvis is measured or located between the lower border of the symphysis pubis going into the two ischial spines, all the way to the lower border of the sacrum. So from this portion going into the both portion or the both ischial spines and connecting posteriorly in the lower border of the sacrum. So whereas the pelvic outlet is located at the lower portion of the pelvis. So the pelvic outlet is divided into anatomical outlet and the obstetrical outlet. Although among the two, the anatomical outlet is considered to be less significant compared to the obstetrical outlet. And the anatomical outlet is formed using the lower border of the pubic bone together with the sacrotuberous ligament. So the sacrotuberous ligament is located on this portion. So the anatomical outlet is from the two pubic bone. So from the two pubic bone going into the sacrotuberous ligament. Whereas the obstetrical outlet is located using, or the obstetrical outlet is formed using the three landmarks. We have the ischial spine. We also have no, it's not the ischial spine, it's the ischial tuberosities. We also have the lower border of the symphysis pubis, and we have the sacrococcygeal joint at the posterior portion. So again, the obstetrical outlet of the pelvic outlet is formed using the landmark lower border of the symphysis pubis, the two ischial tuberosities, and of course the sacrococcygeal joint. So as you can observe as you can observe, connecting the three landmarks will create a straight line, that is to be a diamond shape. So using these three landmarks, we have what we call the three diameters of the obstetrical outlet. First one, we have the anterior posterior diameter, which is measured from the lower border of the symphysis pubis going into the sacrococcygeal joint. So if we measure from this portion until or all the way to this portion, that measures around 10 to 11.5 centimeters. Whereas the transverse diameter of the pelvic outlet is measured between the two ischial tuberosities, which is approximately 8 centimeters. And the oblique diameter is measured between the obturator foramen going into the sacrospinous ligament. If you say sacrospinous ligament, that is the ligament between the sacrum and the ischial, going into the ischial spine. So the oblique diameter measures around 12 centimeters. So again, the pelvic outlet is considered to be more significant compared to the anatomical outlet, and the obstetrical outlet creates or forms three diameters, which is the anterior posterior diameter, which is measured from the lower border of the symphysis pubis going into the sacrococcygeal joint. We have the transverse diameter, which is between the two ischial tuberosities, and of course we have the oblique diameter. So what is the significance in learning or identifying the different pelvic diameters? So identifying the different pelvic diameters, or the standard or the normal diameters of each pelvic diameter, is considered to be important in order for us to determine if the fetus can pass through the pelvis or if vaginal delivery is possible. Because as we all know, the fetus or the fetal head will pass through the pelvic inlet going into the mid-pelvis, and of course going out through the pelvic outlet. So the fetal head will pass through these different portions of the pelvis. And if in an instance that the head is larger than the diameter of the pelvis, vaginal delivery is not possible, and the only option for that is through cesarean section, or what we call the abdominal delivery. So that is all for this session, and I will be uploading another video soon.